Why is my dog still limping? Welcome to the world of ball sockets and dogs' hip dysplasia. This is video 4 in a 6-video series that discusses common conditions that cause limping in dogs. What is canine hip dysplasia or CHD? Is the displacement of the head of the femur from its normal position inside the hip joint, the hip socket. What causes canine hip dysplasia? Let's find out right now. First of all, let's look at the structure of the dog's hip joint. I've got 3 images there, and I'm going to show you how the hip joint looks like and how the head of the femur comes out of the socket. So, the hip joint composed of the femur, the neck of the femur, of the head of the femur. This is the head of the femur. This is the neck of the femur. This is the shoulders of the femur. The socket, which we call the acetabulum, is formed by 3 bones, right? And come right here. The acetabulum or the socket is made up of 3 bones. You got the ilium, you got the ischium, and then you got the pubis here. Right? 3 bones. The pubis forms the floor of the pelvis. Alright? You got a left and right lateral ilium, ischium, and the pubis. So the cavity or the joint, the socket, the hip socket, formed by 3 bones, the ilium, the ischium, the pubis. Okay. Go back to this one because this is the most important. A normal hip should have the socket deep enough to hold and contain about over 55% of the head of the femur. This diagram shows the head of the femur is actually over 60%. You will draw a line from here. Okay? The head of the femur, over 60% of the head of the femur is inside the socket or the inside the acetabulum. A very, very stable hip joint, at least 55% of the head of the femur should be inside the acetabulum or the socket. It's just a dislocated hip joint, or it looks like. But you can see on this diagram here, which is also a normal hip joint. If you draw a line from here, it is got roughly about 50%, right? Over 50% of the head of the femur is inside the socket. Anything less than 55, you have some instability in the hip joint. Osteoarthritis causes the loss of bone around the head of the femur. It causes loss of bone around the acetabulum. You start getting hip instability. So that's how the hip joint looks like. And then we shall just summarize that. The dog's hip joint is comprised of the head of the femur, a rounded protuberance that fits smoothly into a conforming socket called acetabulum. The socket of the hip joint is formed by 3 bones, the ilium, the ischium, and the pubis. The hip joint is a good example of a ball and socket joint. How does a normal hip joint look like? A stable hip joint must have a socket deep enough to hold at least 55% of the surface of the head of the femur. This is what we are seeing, just discussed there. That is what we discussed there. All right. Here I've got an X-ray of the hips of one of the dogs I've had the pleasure to take X-ray of. And this dog has some osteoarthritis. Right? But even with the osteoarthritis, you can see on this side you have at least 45% of the head of the femur inside the joint cavity, or the joint socket, between the acetabular. That is on the left side. On the right side, you have only about, I would say about 25 to 30% of the head of the femur is inside the socket. Right? It's bad osteoarthritis, but it's not extremely bad. You see a very bad head dysplasia, right? The black area around the head of the femur is lost cartilage. So you have just two bones colliding with one another, the head of the femur and the surface of the acetabulum. Here you have even very irregular head of the femur because there's a lot of wear and tear around there. And so you have new bone growing on this area here. So the joint, the head of the femur is not smooth and round, right? Because you have osteoarthritis. Okay. The shallow the socket is, the greater the chances of dysplasia or laxation from traumatic injuries or osteoarthritis. So how do dysplastic hips look like? All right. Here's another dog that I had the pressure of taking X-ray. You can see this dog has extremely bad hip dysplasia. Right? You can see the head of the femur is completely out of the socket, and this dog doesn't have any socket at all, right? The head of the femur just has ground, has been grinding on the edges of the acetabulum. You can see the head of the femur is completely out of it. Okay, the same one with this one here. This is a very severe hip dysplasia, right? The head of the femur completely out of the socket, which the socket is not even there, right? Too much inflammation there. Dog doesn't have any socket at all, all right? This dog must be in a lot of pain. All right, hip dysplasia is a hereditary condition, especially common in large breed dogs like the Great Danes, Labrador Retrievers, and German Shepherds. Hip dysplasia is one of the most common orthopedic hereditary diseases in dogs. There is evidence to show that hip dysplasia is not a congenital disease, and puppies are born with normal hips, which then that turn dysplastic for various environmental factors. So how do normal puppies' hips turn dysplastic? I have encountered several 8-week-old French bulldogs with very severe hip dysplasia. What was characteristic about these puppies is they were all overweight, very active, and tended to rest on the underbelly with all legs outstretched sideways. The first 8 weeks of a puppy's life is a critical period in the development of the hip joint. During this period, the conformation of the hip joint socket, the head and neck of the femur are very susceptible to modeling. What now turns normal puppy hips dysplastic is not well understood. However, factors like nutrition, excessive weight gain, level of physical activity can all contribute to the development of hip dysplasia. What are the clinical signs of canine hip dysplasia? Slight to moderate limping, abnormal gait, difficulty standing and reluctance to climb stairs. How do you diagnose canine hip dysplasia? Physical examination and palpation of the rear legs to assess hip laxity will point you in the right direction. Radiographs of the hips will confirm diagnosis of canine hip dysplasia. Is canine hip dysplasia preventable? Not really. However, controlled feeding of the puppies, weight management, and physical activity can go a long way in reducing the severity of the hip dysplasia. How do you treat hip dysplasia? There are several surgical techniques for realigning the leg conformation and eliminating osteoarthritis. Non-surgical options for treatment of a canine hip dysplasia involve use of non-steroid anti-inflammatory medications, together with the management of the dog's body weight and physical activity. Your veterinarian will always be there to discuss the right treatment options for your dog. And that's the end of the video. If you liked what you have watched, subscribe, share it, comment, or ask a question below. Thank you for watching, and see you in the next video.